Let's continue our discussion of autism spectrum disorder, and today we're going to talk primarily about issues of treatment. So what do we know about autism? Most children with autism are male, so about 4 to 5 to 1, but no differences in terms of race, national origin, class, parental education. Comorbid problems, include seizures and speech problems and low IQ. Although it's a spectrum, and so there are people like Rosie King and Temple Grandin who have good speech and good IQ. Speech and IQ are indicators of good prognosis. I'm just pointing here to the video of Christina on D2L. Christina is at the lower end of the spectrum. In this case, what you hear is from her behavioral health worker who has helped her in the school system. So here's one way of assessing and rating an autism spectrum disorder. And so you can see, again, this sort of spectrum kind of idea, thinking about, where is this person here and how much impairment is there? And this helps us to recognize when there's been some improvement. Okay, so here's where we come into controversy. When I was in college, we talked about some of the problems with parenting. And while, yes, it appears that there can be some problems with parenting, probably we should be thinking about those parenting problems as either being some of the normal kinds of things you would expect, or also related to some of the stress of raising a child with autism. No evidence for a vaccine problem. Taylor et al.'s research suggests, or really looked at this pretty carefully and found absolutely no evidence. In addition, the complaint about vaccines has really been about mercury in vaccines, which has been out of the vaccine since 2001. There is some suggestion of genetics. So there's a pretty moderate concordance for identical twins, not for fraternal twins. There is an increased rate of diagnosis for the siblings of a child with autism. I actually have a former student who has 3 children, 2 of whom are on the spectrum. One at this point is nonverbal, or mostly nonverbal, and the other is actually pretty verbal. There's also some suggestion of brain injury. So remember, we were talking about seizures before. Also, if we're looking at discordant twin pairs, the twin with autism generally had a birth complication of some sort. In terms of treatments, drugs can make it easier. So I believe Temple Grandin in Thinking in Pictures talks about herself as taking Prozac at various points, that it helps with some of the anxiety that she experiences. And if you think about some of the repetitive behaviors as being related to anxiety, you can see how SSRIs might decrease that. And sometimes stimulants can increase attention. Most of the focus, however, is on behavior therapy of various sorts in the home and the school in order to help decrease self-injurious behaviors, to help them develop communication and social skills, to help teachers and parents identify more effective ways of dealing with this child. Generally, what we want is early intervention. Early intervention is critical, and actually with all of the mental health issues that we're going to talk about. Some suggestion that Albert Einstein was on the spectrum. Obviously, he wasn't diagnosed at that point. But generally, prognosis is better when IQ is better, when verbal skills are present at an earlier age. About 25% of adults can live independently. 25%, function in a more supportive environment. So, think about our spectrum. So what should you do now? I think one of the things that you should think about is some of the ways that awareness is both a good thing and perhaps not a good thing. So one of the reasons that we may have seen that significant increase in the number of kids diagnosed with autism is that parents are much more aware of autism now. Their physicians are much more aware of it. And, it's with that diagnosis in Pennsylvania, you can get a range of services that will help this child be more effective. That's a good thing. On the other hand, all of us taxpayers are paying for those increased services. So maybe you think it's not so good. So think about those things. Think about the diagnosis as occurring within that context, political context, and take care.